The human skin, your body's amazing supersuit. Introduction. If you could unzip your body, what would be the first thing you'd see? Your skin. The human skin is not just something that covers us, it's a powerful, living organ that protects, senses, heals, and regulates our entire body. In fact, skin is the largest organ in the human body, making up about 15% of our body weight. What is skin? Skin is a complex organ that acts as a protective barrier between our internal organs and the outside world. It shields us from injury, germs, sunlight, and extreme temperatures, while also allowing us to feel touch, pain, heat, and cold. Structure of the skin. The three main layers. 1. Epidermis, the outer shield. The epidermis is the thin, outermost layer of skin, the part you can see. Key features. Made mostly of keratinocytes, which produce keratin, a tough protein. Contains melanin, the pigment that gives skin its color. Has no blood vessels. Constantly renews itself every 28-30 days. Functions. Protects against bacteria and viruses. Prevents water loss. Protects from UV radiation. Determines skin color. Fun fact, dead skin cells fall off your body every day. Yes, even right now. 2. Dermis, the support center. Beneath the epidermis lies the dermis, thicker, stronger, and packed with activity. What's inside the dermis? Blood vessels, nerves, hair follicles, sweat glands, oil sebaceous glands, collagen and elastin fibers. Functions. Provides strength and flexibility. Regulates body temperature. Supplies oxygen and nutrients to the skin. Allows sensations like pain, pressure, and touch. This layer helps your skin stretch, snap back, and heal when injured. 3. Hypoepidermis, the foundation layer. The deepest layer of skin is the hypodermis, also known as subcutaneous tissue. Made of fat cells, connective tissue, functions, insulates the body, stores energy, cushions organs, anchors skin to muscles and bones. Major functions of the skin. Protection. Skin is your body's first line of defense. It blocks bacteria, chemicals, and physical damage. Temperature regulation. When you're hot, your sweat glands release sweat to cool you down. When you're cold, blood vessels tighten to conserve heat. Sensation. Tiny nerve endings allow you to feel touch, pain, pressure, heat, cold. Water balance. Skin prevents excessive water loss while keeping harmful substances out. Vitamin D production. When sunlight hits your skin, it triggers the production of vitamin D, essential for healthy bones and immune function. Excretion. Through sweat, the skin removes small amounts of waste such as salts and urea. Skin color and melanin. Skin color is determined by a pigment called melanin. The more melanin you have, the darker your skin, and the better protection from UV rays. How skin heals itself. When skin is injured, it goes into repair mode. Blood clots form. New cells grow. Collagen rebuilds tissue. A scar may form. This healing ability is one of the skin's most incredible powers. Caring for your skin. Healthy skin needs care. Stay hydrated. Eat nutrient-rich foods. Protect your skin from excessive sun. Keep it clean and moisturized. 1. Acne. How it affects the skin. Clogged pores lead to pimples. Blackheads, whiteheads, cysts, and inflammation often appears on the face, chest, and back. Treatments. Topical creams, benzoyl peroxide retinoids, oral antibiotics, hormonal treatments, proper skin hygiene. Cure. No permanent cure. Can be controlled and often improves with age. 2. Eczema, atopic dermatitis. How it affects the skin. Causes dry, itchy, inflamed, cracked skin. Skin barrier becomes weak and sensitive. Treatments. Moisturizers, steroid creams, antihistamines. Avoiding triggers, soaps, allergens. There is no cure but can be well managed. 3. Psoriasis. How it affects the skin. Rapid skin cell growth causes thick, scaly red patches, can crack and bleed. Treatments. Steroid creams, vitamin D creams, light therapy, immune suppressing medications. There is no cure. Chronic but manageable. 4. Vitiligo. How it affects the skin. Loss of skin pigment causes white patches. Skin cells producing melanin are destroyed. Treatments. Topical steroids, light therapy, Cosmetic camouflage. There is no known cure, but repigmentation may occur in some cases. 5. Rosacea. How it affects the skin. Persistent redness, visible blood vessels, bumps on the face, especially cheeks and nose. Treatments: topical antibiotics, oral antibiotics, laser therapy. Avoiding triggers: heat, alcohol. No cure, symptoms can be controlled. Dermatitis, contact dermatitis. How it affects the skin. Redness, itching, and blisters are caused by contact with irritants or allergens. Treatments: avoiding irritant, steroid creams, antihistamines. Cure: yes, if the cause is avoided. 7. Fungal infections, ringworm, athlete's foot. How it affects the skin. Red, itchy, scaly patches may spread in circular patterns. Treatments: antifungal creams, oral antifungal medication. Cure: yes, with proper treatment. 8. Bacterial skin infections, impetigo, cellulitis. How it affects the skin. Redness, swelling, warmth, pus-filled sores. Treatments: antibiotics, topical or oral. Proper wound care. Cure: yes, with antibiotics. Viral skin conditions, warts, herpes. Viral skin conditions are common skin issues caused by viruses, including widespread ones like warts, molluscum contagiosum, cold sores, genital herpes, herpes simplex virus, and shingles, varicella zoster virus, as well as childhood exanthems like chickenpox, measles, and hand, foot, and mouth disease, often presenting as rashes, blisters, or growths and varying from mild to severe, sometimes requiring medical attention. Common examples: warts, HPV, benign skin growths caused by human papillomavirus, HPV, appearing as rough bumps, common warts, plantar warts on feet or flesh-colored growths, genital warts, molluscum contagiosum, smooth, dome-shaped pearl-like bumps, papules caused by a poxvirus, easily spread by skin contact, appearing in clusters. Herpes simplex, HSV, causes cold sores, HSV1, around the mouth and genital herpes, HSV2, characterized by painful, fluid-filled blisters. Shingles, herpes zoster, reactivation of the chickenpox virus, VZV, causing a painful, blistering rash in a band on one side of the body. Chickenpox, varicella, a very itchy rash with blisters. Fever and headache caused by VZV, often in children. Hand, foot, and mouth disease, flat spots or sores on hands, feet, and inside the mouth, caused by coccidiosis viruses. Measles, rubeola, high fever. Cough, red eyes followed by a red, blotchy rash starting on the face and spreading. Pityriasis rosea, a rash that may start with a single larger patch, Harold patch, and then spread, possibly triggered by a virus like herpes. When to see a doctor. Seek professional evaluation if you experience painful, rapidly spreading, or blistering rashes. Signs of infection like pus, warmth, or significant swelling. High fever or severe systemic symptoms. No improvement within a week or if symptoms worsen. Diagnosis and treatment. Diagnosis often involves visual inspection, but sometimes skin scrapings or biopsies are needed, especially for unusual cases or immunocompromised individuals. Treatment depends on the virus but can include antiviral medications for herpes, cryotherapy, freezing warts, topical treatments, or sometimes no treatment as many resolve on their own. 10. Skin cancer. How it affects the skin. Abnormal skin growths, moles that change color, shape, or size. Treatments: surgical removal, chemotherapy, radiation therapy, immunotherapy. Cure: often curable if detected early. 11. Hives, urticaria. How it affects the skin. Raised, itchy welts caused by allergic reactions. Treatments: antihistamines, steroids, severe cases. Cure: usually temporary and resolves on its own. 12. Alopecia areata. How it affects the skin. Hair loss due to immune system attacking hair follicles. Treatments: steroid injections, topical treatments. Cure: no guaranteed cure. Hair may regrow naturally. 13. Scabies. How it affects the skin. Intense itching and rash caused by mites burrowing under the skin. Treatments: medicated creams, washing clothes and bedding. Cure: yes, with treatment. 14. Lupus, skin involvement. How it affects the skin. Butterfly-shaped rash on face, photosensitivity, sores. Treatments: steroids, Immunosuppressive drugs. Sun protection. Cure. No cure but can be managed. 15. Melasma. How it affects the skin. Dark patches on the face due to hormonal changes or sun exposure. Treatments. Skin lightening creams. A sunscreen. Chemical peels. Cure. Often recurring. Can fade with treatment.